Hello everyone, welcome back to my class. For the diagnosis of injury, we have studied the classification of injury. In addition to the medical history, the most important knowledge we need to know is the signs and symptoms of injury. After the human body suffers injury due to external force, due to the pathological changes of qi and blood, yin and wei, skin, flesh, muscle and bone, meridians, accessory and body fluid. A series of local and systemic symptoms and signs of injury occur, which provide us with valuable information for clinical diagnosis and selection of treatment regimens. Next, we will discuss from the systemic and local symptoms of the injury. First of all, let's take a look at the all-body symptoms. For mild injury, generally there is no symptoms on the body. But if there is a more serious injury, qi stagnation and blood stasis may occur, such as fatigue, constipation, and emaciation with purple tongue, string, pulse. Some patients suffer from siltation heat, such as fever, thirst, bitter taste, upset, red urination, dysphoria, red tongue, rapid pulse, and other symptoms. Of course, pallor, cold limbs, cold sweat, thirst, decreased blood pressure, shock, and other symptoms may occur in very severe injury. These are the symptoms of injury commonly seen in the clinical practice. Next, let's take a look at the local symptoms of the injury. At first, please look at the above three fingers. The first clinical chief complaint provided to the doctor after these three patients arrive at the hospital is pain. Pain is also the most common symptom of both fracture, dislocation, and soft tissue injuries in the whole traumatology. Then, when the patient describes the pain, we need to understand the location and the nature of the pain, as well as the condition induced by the pain, whether it is direct pain or indirect pain. Indirect tenderness also involves whether there is crushing pain or percuting pain. Patients who suffer dislocation often suffer from extensive pain around the dislocation joint. But the chronic strain is swelling pain and achy pain and is related to weather changes, all of which belongs to the scope of pain. It is called the first clinical chief complaint. In addition to pain, some patients may have other local signs, such as local swelling, fixed swelling site, and prolonged congestion. Some severe swellings are accompanied by the tension vesicle. There are also patients with skin abrasion and ecchymosis due to trauma. Swelling and ecchymosis are very common local symptoms in traumatology, and swelling is more common than ecchymosis. For the third local common symptom, we call it dysfunction. Due to severe local pain after injury, reflex muscle spasms as well as tissue and organ damage may cause the limb dysfunction. For example, patients with distal radius fracture can no longer perform the extension and flexation of wrist joints. And patients with knee joint can no longer perform the knee flexation and extension and working on the ground. Even after surgical rehabilitation, it is possible to work with crutches for a long time. Therefore, pain, swelling, and dysfunction are the three most common types in the local symptoms. After learning the local symptoms, let's study some special symptoms. which should be mastered by everyone. Special symptoms mainly include deformity, bone characters, abnormal activity, glenoid emptiness, and elastic fixation. The first is deformity, whether it is fracture dislocation, congenital disease, or bone disease. Patients will have some appearance deformity at different sites. For example, the picture is a distal radius fracture, which is a fork-like deformity, like the fork we use bunked down on the table. Fracture, in addition to deformity, has a characteristic, etc., bony carapatus. The so-called bony carapatus is the sound occurring after the two broken endings of the fracture collide with each other. When the medical staff move the patient, they obviously feel bone rubbing under the hand and can heal the bony carapatus at the same time. So, everybody, you can think that if there is a bone carapatus and bone rubbing in the process of carrying the patient, then it shows that this patient suffers from an extremely local pain. Therefore, we should not deliberately feel the bone rubbing or listen to the bone carapatus when performing this special symptom examination. Second, for this kind of pseudo activity that should not occur at the joint motion site, we generally judge that there is a fracture in this site, which is called pseudo-arthrosis activity or abnormal activity. Relative to fractures, dislocations also have some special symptoms. In addition to deformity, that is glenoid emptiness and elastic fixation. Looking at this X-ray, the appearance of the shoulder joint shows that the humeral head, indicated by the blue arrow, is under the acromion and is indeed below the glenoid on the extreme plane film, which is a unique sign of dislocation. So, what is glenoid emptiness? The glenoid should be filled with the articular head, but at this time the joint head dislocates, then this part is empty. And in the patient's appearance, shoulder dislocation appears square shoulder deformity. After the occurrence of dislocation, the muscle spasms and contraction around the joint maintains the dislocation bone and at a special position, and the joint can move in a small range during passive motion. But the dislocated bone and returns to a special position after the end of passive motion, which is called elastic fixation. The above are systemic and local symptoms and signs, as well as some special systems and science. Here is only a simple introduction. Especially, we will give a detailed explanation in the overview of fracture, dislocation, and soft tissue injury, so as to help you make a deeper understanding. See you next time. Thank you.